and welcome to tonight's HRI talk. My name is Hillary Dort, and I'm the manager of communications at HRI. For those of you joining us for the first time, HRI talks present new ideas, discoveries, and studies that are helping to transform the mental health and substance use health landscape in Canada and beyond. When mental health concerns collide with the demands of the workplace, there can be obstacles for everyone involved: the person living with the disorder, their care provider, their employer, and their insurance provider. And in many cases, it can be further complicated by administrative processes and red tape. This can lead people to feeling confused, frustrated, or even overwhelmed. Tonight, we will discuss the need for a collaborative approach to navigating the complexities of depression and the workplace. You'll hear from diverse perspectives on this topic, including a person with lived experience, a researcher, and a clinician. I'd like to begin this evening by sharing that the offices of HRI are located on the traditional lands of the Anishinaabe, Attawandaron, Haudenosaunee, and Métis peoples, and the treaty lands of the Mississaugas of the Credit. We support the Truth and Reconciliation Commission of Canada's calls to action, and we are continually working to be more inclusive in our research and in our everyday practices. We want to do our part to promote reconciliation and healing, and we invite any input you may have on how we can do better going forward. For those of you who are not familiar with HRI, we conduct applied research with a goal to improve mental health and substance use health services in ways that can benefit more people sooner. So we work with leading scientists, clinicians, people with lived and living experience from across Canada and beyond. As a registered charity, donations do play a vital role in supporting our research and amplifying our impact. We ask that you consider making a donation today. If you can, go to our website and click the donate button. Thank you. And finally, before we begin, I'd like to extend our deepest gratitude to our corporate sponsor, CIBC, and our supporting sponsors, KPMG and the Otsuka-Lundbeck Alliance. HRI Talks wouldn't be possible without the generous support of our sponsors. Our moderator this evening is Hannah Sung, journalist and co-founder of Media Girlfriends, an award-winning podcast and video production company in Toronto, Ontario, Canada. Welcome, Hannah.
Thank you so much, Hillary. Hi, and it's really nice to be here tonight. Welcome to everybody, because tonight's topic is so important. I'm so thrilled that you can make the time to be here. The event is called Depression in the Workplace Toward a Collaborative Approach. It's all about working together to support people experiencing depression. And it's not only you who are here, we've got 275 people registered from 6 countries for this HRI talk. So thank you very much for being here to learn with us. Tonight, we will have a moderated conversation with expert panelists for about 20 minutes. After that, we want to hear from you, our audience. You can ask questions by using the Q&A button at the bottom of your screen at any time during the presentation, and we'll get to as many questions as possible before we wrap up on the hour. I'd like to introduce our panelists now, who are here to share insights and real-world examples from their research, clinical practice, and personal experience. So joining us tonight are Peter Burgess, who will share his story. Hi, Peter. He'll share his story of navigating mental health in the workplace. Dr. Pratap Chokka, clinical professor in the Department of Psychiatry in the Faculty of Medicine and Dentistry at the University of Alberta, and psychiatrist and founder of the Chokka Center for Integrative Health. And I think he'll be turning on his camera very soon. Hello, Pratap.
Hi,
As well, we're being joined by Dr. Carolyn Dewa, professor in the Department of Psychiatry and Behavioral Sciences at University of California, Davis, and collaborating scientist at the Center for Addiction and Mental Health. Hi to everyone.
Hello.
So, yes, so glad we could all be here. You know, our goals tonight, we've got 3 of them. We want to explore the challenges presented by depression and the workplace. We want to gain insights from diverse perspectives, and we want to discuss collaborative pathways to potential solutions. So I'm going to kick things off with you, Pratap, if that's okay.
Sure.
I want to ask you, in your professional experience of helping people who experience depression, can you tell us just how much it can impact a person's ability to perform at work?
Yeah, and unfortunately, I see this every day. It's quite impactful. I mean, if you look at the numbers in Canada, Hannah, I mean, we think about 10% of Canadians may suffer depression. And when you look at their ability to work, we think that about a third of them are not working because of depression. That's a sizable number. And even those that are working will tell me that their quality of work, their productivity of work is not where it should be, And so at an individual level, there's so much suffering. And at a societal level, we look at the economic ramification of this. The word absenteeism are for people who are not going to work. And we think in Canada about $2.5 billion. I mean, there's so many numbers there, I can't even put my head around it. And the economic burden of presenteeism, which is you're at work, but you're not really there and doing the qualities like 6.8 billion. And now, when you look at the statistics of disability claims, it seems like mental health claims are probably the number one cause of disability claims now in that particular world, which was different than probably 15, 20 years ago when physical disorders kind of dominated the disability world. So, I mean, this is a major problem for us and definitely for the individuals that I see and treat. Work and mental health and depression is really a major concern for them.
Mm-hmm. And you did say an interesting word there, an interesting word to me, presenteeism. I know absenteeism, but presenteeism, I guess, is also a thing where you are showing up, but you're not really maybe as performing as you normally would. I wonder, Carolyn, if I can get you to jump in a little bit to tell us a little more about the scope of the problem when we want to understand how prevalent depression is in the workplace.
Well, it's interesting because it's just not Canada, it's the whole world. Among workplaces and workers, where we know that about 8 to 11% of people at work who are employed are experiencing depression in a 30-day period. So in 1 month, during a 1 month period, we know that at least about 10% of workers will experience depression. And as Pratap said, a lot of that, we know that about 3% go on to disability. So if there's 10% of workers who are experiencing depression, most of them will be at work. And part of the biggest cost of depression is for that presenteeism. And it's people aren't able to function as they can normally because of the symptoms that they're feeling and experiencing. So that's where a lot of the loss is. But it's also interesting that in the last 20 years, we have developed a lot of effective treatments. And the key to that is getting people to get help quickly and early on. If they get help quickly and early on, we know that we can help shorten an episode by at least 3 weeks. So, but we know that also about 60% might feel hesitant to seek help, or not even recognize that they need help or could use help. So we have hope, we have effective treatments, but part of it is helping people understand that yes, it's for them, and that they are also included in that hopefulness. It's not the end of their career. And just to be able to explain that to folks would also help address some of the losses that we have as a country because of depression. The estimate that we came up with was about 51 billion was lost each year related to mental illnesses. So, but there's hope. And I think that's what we wanted to talk about today too, that how do we get people there?
Yeah, how do we collaborate to get towards solutions? I love, Carolyn, that you're a researcher and what you've come away with is hope. That's I love that. And I would love to bring Peter into the conversation now because we've heard about the scope of the problem, which frankly the numbers really surprise me. And so it's quite a large problem. Peter, you have your own personal story. I would love to know about how you first became comfortable with talking about mental health in your own workplace.
So it's something I've dealt with all my life, all my adult life. And I was one of the 3% who did take a leave of absence to because I didn't understand the nature of my illness, and it's often difficult to know when you're in that depressed state. When I returned to work, I was a little bit hesitant to talk about it. It's when you return to work, you're very vulnerable, and as someone who's been off and maybe you're working your way back to normal functioning, I didn't have the confidence in myself to discuss it, and I was very concerned about how others would react. Now, I was very fortunate, or I am very fortunate. I work for government, and in government, you are very well protected in terms of who can say what. That being the case, the people I worked with obviously knew I'd been off, and it was a bit of an elephant in the room. And I made the decision fairly early on that I wanted to address that elephant in the room. I wanted people to be comfortable. I needed to be comfortable. And what I found was, with the vast majority of people, you get nothing but support and positive reactions. The first person I told was my immediate supervisor, and boy, I couldn't ask for anything more. There are cases and places where I've had negative reactions, and at first that hurt, but I sort of came to the conclusion that, if this disease is part of me, it's made me who I am, and if me having a mental illness is going to change what you think about me, then I don't really put a lot of stock in your opinion. And as time has gone by, I've been very vocal. I don't. I look for people that I think may be having trouble, and just let them know that it's okay, that there is hope, that there are people out there like Dr. Chokka who can help you. You just have to ask for it and accept it.
I wonder, Peter, is there any way to pinpoint specific things that did give you the confidence to overcome the fear of talking about it at work?
It was my initial contact with that particular supervisor, and I think if that had gone sideways, I would have been much less comfortable. I had an experience later on in my career where I had a supervisor who reacted quite negatively, and had that happened in the opposite order, I'm not sure where I would be or whether I would be as open about it. But I was fortunate, and again, most people are really kind and they want to help. It's kind of, they don't know what to say. Am I going to set this person off, or whereas if you're upfront about it, you can have a discussion.
I'm so glad that the reaction from that first supervisor that you told was a positive one. There is really that question of what would have happened if it had not been a positive reaction. I wonder if we can go to a poll question now, because I would love to know about who is attending the Zoom, who is here to learn. And we have a poll question so that we can all learn a little bit about why people have come tonight to this talk. And it is, how do you relate to depression in the workplace? All you have to do is click one of these. I'm experiencing or have experienced depression. I'm trying to support a friend or colleague with depression. I am a therapist. I manage people, or I'm an employer. I work in the insurance sector, or other. So 40% of people here tonight, they are experiencing or have experienced depression. But a significant number are trying to support a friend or colleague with depression. 14% of you are therapists. 25% of you manage people, or you're an employer. Nobody from the insurance sector, and 12% of you are other. So that would be various reasons. Thank you so much for participating in that poll. I think it's interesting for us too on the panel to know who is here and what perspectives you may be coming from. I would love to go to you, Pratap, and Carolyn, both of you, because you collaborated on a research article in Frontiers magazine. And the main aim of the report was to provide guidance to clinicians who are treating work-related depression. What were your main takeaways in this research? Who wants to start?
Well, I think I reached out to Carolyn because I knew that she was doing research in this area. And just like Peter has these concerns about the work environment, as a psychiatrist and as a clinician, one of the things, Hannah, we're seeing is that clinicians, especially in mental health, don't have the training or the tools to properly assess mental disorders, especially depression, as it relates to the workplace. So there's this broad, heterogeneous approach. And so just like Peter found a good supervisor, you may find a good clinician, a family doctor or psychiatrist who really is aware of these kind of nuances we're talking about today, who has the skills to be able to properly diagnose and tease out what is work-related, what isn't, what's person, issues with the person, the family, and all that, and put it all together and assess properly. And we're finding that clinicians are not trained in this. I never got trained in medical school in my residency of how to assess patients in mental disorders as it relates to the workplace. So we don't have common language. We're asked to fill out disability forms and insurance forms. And when, patients bring this in, we get frustrated. I feel terrible for the patients because they feel like they're a burden on us. So what we wanted to do was to have these sort of general principles. And we wrote it from a Canadian perspective, but as Carolyn said, and Frontiers is an international magazine in psychiatry that goes to a broad range of individuals, that we could at least have a working document that can, puts in a concise form what these problems are. How do you go about assessing patients with workplace depression? What are the tools? What are the treatments? What are the interventions for the individual, for perhaps advice to the workplace? What can we do to advocate, to communicate with the insurance world, the employer, the HR? So this is fairly nuanced. And so we wanted a template as a starting point, and we're excited about it. And I got a comment from the editor, Hannah, saying that this was one of the most widely read and downloaded article internationally that they've had in the last few months. So it just shows you that clinicians are thirsty for this as well. So that was the thing, common language to attack a really common disabling problem, which we're not trained in. So that's why we brought together these diverse groups of individuals to be able to get it out. And now we're going to have to educate clinicians who are working in this area, and well, which is everybody that has to deal with patients in workplace. So, I mean, that's my particular view. Carolyn, you've been doing this research much longer, and what's your take on what we did?
So I was excited about when I first heard about the project when Pratap called, because one of the research projects that we did was to ask physicians, what was it like working with workers who were struggling with depression. And one of the things they talk about is not knowing where you usually as a clinician are advocating for your patient. Then when you talk about disability and you fill in the forms, you also are being asked by insurance and the companies to also be on an agent for them to help them assess whether the worker should be on disability or what types of supports that the worker needs. So now it's there's a tension and between, oh, who am I an agent for, and what if there's a conflict there? And so I think this paper helps to better delineate, well, what should you do and how can you help both parties so that it's a win-win situation. And then talking about from the worker's standpoint too, about stigma and who do you ask for help and how do you ask for help and how do companies help their employees ask for help.
And one of the things I can just add, just from a clinician's perspective, is this whole world of dealing with the worker, the employer, the insurance people, it's a very adversarial, potentially viewed as an adversarial process, Hannah. And part of what we wanted to do was to bring all of these individuals together to say, look, we've all got the same goal, and that's to get our worker back to work or get him to optimally function. And everybody in this world that we deal with disability really has that in mind, I find. It's not as adversarial as we're taught and as we think it to be, that the hearts of the insurance company, the HR, most employers are pretty good. And I think we need to destigmatize that particular way that clinicians have often been left feeling when dealing with patients, is that it's not as adversarial. Let's get the full information. Let's work together for the good of the worker.
It sounds like such important research in terms of questioning or stress testing. Why is it adversarial when it really should be collaborative? And it's the information, hopefully, that really can bring people together on how to create better policies and support individuals. I wonder if now we can go to another poll question to find out a little bit more about people in the room. The poll question is, do you feel it is safe to speak about experiencing depression in your workplace? So that's a simple yes, no, or unsure. Those are the options. 44% say yes, you do feel it's safe to speak about experiencing depression. I see a lot of nodding among the panelists. 34%, however, say no, it's not safe. And 22% say unsure. Is anybody surprised on this panel by these results? Or does it seem really in line with what you have seen?
I'm not surprised, but this is really positive. And I wonder what this poll would have shown 20 years ago. Because there is so much more open discussion in the workplace, and I think employers are making concerted efforts to destigmatize depression and mental illness. And so I'm not surprised, but I see this as being hopeful.
Yes, and Peter, you were talking about that positive, compassionate response from your first supervisor that you opened up to. And I'm wondering if you have any other examples of what has worked well in the workplace as an employee who wants to help be part of destigmatizing mental health issues and talking about depression. And, after you, Peter, I want to go to Carolyn and Pratap as well to talk about what you feel are ways that workplaces can make things safe But first, I'll start with you, Peter.
So what I see in the area I work, or the department I work in, is, and I think across government, is a real concerted effort to communicate with employees and to provide information about mental health and mental illness, and sort of open the shutters on, and really they're making a concerted effort to destigmatize it. It's something that 20 years ago or 25 years ago just wasn't available. It wasn't common. And I think in the last 5 years, we've had sort of a standing committee, if you will, that is responsible for championing mental health issues and education just within my department. So it's the education and awareness that is changing.
I love when education is integrated into the workday and into people's workflow, because we spend so much time at work. This is where we should be learning about all kinds of things. I wonder, Carolyn and Pratap, if you could tell us a little bit about what you've seen in your research in terms of what's really good in the workplace, what is working, as Peter has said. Maybe also if you want to talk about red flags of what you still see that is not working.
So I think a lot of the progress that we see is part of the because of Canada decided that it was going to make this a priority issue, and it established the Mental Health Commission of Canada, which did a lot to try to educate and raise awareness. And I mean, Canada has the Bell Talks Day, where mental health is highlighted and people come out and talk about their experiences with mental health, and as it becomes a normalized conversation. Well, when I did a research in Ontario looking at who would you tell your manager if you were experiencing a mental illness, we found that about 61% of people said they would. And when we asked why, the important things that they cited were the relationship with the manager, as Peter said, the support of colleagues, so in the work unit, and then organizational practices were what would convince them to do it. Those who wouldn't, it was because they were afraid for their careers, or they saw other people have bad experiences, or they didn't think it would affect their work. So they didn't see that people, that they were seen and that they were valued. They thought of themselves as just cogs in the wheel and just another cog, so no one would notice. So that is a lot of the organizational culture that is important for people to feel confident in the workplaces.
Mm-hmm.
I think for myself, I kind of want to set some general principles with my patients and workers when it comes to this area. And one of the things that is very clear in the science literature is that good work is good health. That people who are actually in healthy jobs live longer, they're happier, they're productive, they can provide not only to their family but to their community. Conversely, not working or working in very toxic environments has actually shown to be higher risk of suicide, engaging in deleterious habits such as addictions, experiencing higher rates of high blood pressure and cardiovascular problems. So I look at the importance of work as important as nutrition and exercise. That it's really important for us to establish the general principle. Now, I know that there's all these work issues that will pretend potential workplace, and the kind of things that we've identified, it isn't so much the workload. We're all are going to work really hard, but it's when we don't get the reward or a say in that environment. And so this imbalance between expectations, rewards, is really important. And one of the things that continuously comes up in the literature, Hannah, is this idea that you don't matter in the workplace, that you don't have a say. And we're now finding globally this whole world of this idea of isolation and loneliness is a real epidemic. And even in the workplace, this appears to be a real problem. And it's this idea that you don't matter. And you have the work demands, but you don't have the support. And then issues of bullying and harassment are also up there. But it seems that we can do the work if we feel supported, understood, and that what we say matters. And I think that's the kind of interventions that employers and businesses can do. And from a treatment perspective, and we've looked at this, is that I can do what I can with the patient, the worker, with medications and specific therapies, but so-called workplace interventions combined with what we're doing are beautiful. And Carolyn has sort of touched at how we can reduce sickness time and improve quality of work and stuff like that. Simple things like accommodations, right? I always say, stay at work as long as you possibly can, because it's good for you, but let's do it in a safe manner where we can do accommodations. And if you look at the interventions of just accommodations, maybe it's reduced hours, changing the environment that they're in, shift work, and so on. It's so much better than taking them off work. And I think one of the things that clinicians often do is we're left with what's called a medical note, the sick note, and we have no clue of how to identify how much time to give people off.
Mm-hmm.
And so that's why I go back to these general principles that good work is good health. Not working or barely working is not good for us. And then from there, all these interventions can follow, So I think I like that word hope. I think we can do this. I think the trend is hope. And I think as we get to speak about these kind of issues and get all of the parties, kind of working together, I think it's going to get better. I really do.
Mm-hmm. Pratap, I love hearing the specificity of what you say when you're talking about what really harms people in the workplace. And I wish every CEO could invite you in to, basically pick your brain and just learn everything about creating healthier workplaces. This is a great time now to open up to questions. I know that a bunch have been dropped into the Q&A, and this is a great time for you to use the Q&A button if you do have a question that you want to drop in there. Hillary is off camera, but she can read the first audience question for us.
Thanks, Hannah. We've got some excellent questions coming in from our audience. The first one that we're going to start with is, how does one return to work when they've experienced bullying or their manager is not unbiased?
Great question. And I wonder who wants to tackle that one?
I think part of the in the literature and the research is that if your manager is not someone you can trust, that it's really important to find somebody in the organization who you can trust and talk to and get coaching and advice about how to move forward. The other interesting thing is looking at return to work guidelines from other countries like Canada and the UK. One of the things they talk about is that there should be a collaborative leave. So even before someone leaves work, that it should be collaborative so that with somebody, we talked about presenteeism, but in when you're actually experiencing it, you're not doing your work. That means your manager and your coworkers need to do extra work potentially to help support you. So if they don't understand what's going on, it can generate a lot of resentment before that leave. And just giving the manager the space or giving the employees somebody to talk to about, I'm struggling, and having the manager also feel comfortable to ask, do you need help? Or what's going on? You're not invisible. You're an important member of this team, and we want to help and support you. That's an important piece of the whole thing.
And I think the first part of the question mentioned bullying and how to return to a workplace when you've experienced bullying.
I think
I
one of the
wonder if, yes,
just,
please
yeah,
go
maybe, I
ahead.
don't know, Peter, you're going to say something, but one of the things that I'm left with when I have this scenario, which is unfortunately too common, is I need to get more information on this. And one of the problems when you're assessing a concern of this is getting as much information about that particular concern without invalidating the concerns of the individual. And I think one of the things that I think Carolyn has talked about is sort of an integrative evaluation of the problem. Is to get more information. You have to allow the worker or the patient to give you potentially consent for this kind of information to be explored further. And this is where it gets a bit sticky, right? And when you're a clinician evaluating such a concern, yes, we know this can occur. We know it does occur. There's also perceptions of the worker to this particular environment that I need to also weigh in.
Mhm.
And pardon me, I'm a psychiatrist, and so I tend to look at things from not only the cross-sectional perspective, but looking at how one has been raised in their home. Was there trauma? Was there bullying? Was there harassment? All of these things are important for me to get a collective picture on what I'm seeing in front of me. Now, look, patients and doctors, we want to be liked. We want to believe our patients, and I think our patients are honest and truthful. I don't think that's the issue. But are we getting the full picture to look at this complaint? And one of the problems in this system is that the systems don't talk to each other. And without that happening, we really can't get a real clear idea on what the actual problem is. And so that to me is another important aspect of taking a complaint or a situation and having as much information as possible to really attack this instead of just one particular view.
And I would love to hear from you, Peter, in general, maybe if you have any advice about shoring up your confidence when you know it's time for you to return to work.
Boy, that's a really good question, because I have just gone through a mental health crisis, and when you return to work, at least I felt very unbalanced and unsure of myself. I was fortunate in that I got a gradual return to work. It wasn't months, it was weeks, and that helps. And it helps. It helped me prove to myself that I could do the job, that I could still function, that I still was capable of doing what I did before. It also is important again, and I understand that maybe the supervisor is a bit of a problem, but if you can be open, if you can say to the person, this is what I'm struggling with, and I have days now where I go to work and I can't do anything. I have informed my supervisor about this. We have an understanding, and that is that I get my work done by the end of the week. I may not do it at exactly the times that they need me to be there, but the workplace, there's so many strategies they can give you. Different hours and different responsibilities. I might not be comfortable on the phone, so move my responsibility over to more written work. there's all kinds of accommodations that can be made.
There's that word accommodations that had been mentioned earlier too. Yes, thank you for that. Hillary, shall we go to the next audience question?
Yes, thanks, Hannah. So the next question from our audience is, how can you determine if a person's depression is caused or triggered by factors at their job? So perhaps it could be pre-existing depression that is affecting their work, or could it be that there's factors at the workplace itself that are triggering depression in a person?
Carolyn and Pratap, I would love to hear your perspective on this.
Well, that's the million-dollar question, isn't it? And it's so messy sometimes. And so from a clinician's perspective, I think you have a good idea. You've been seeing the patient or the worker for a while of what their pre-existing state is. And so you have that technically, and you can ask them. One of the things we know is the kind of issues that we spoke about earlier of workplace factors that really take individuals into a much worse state. And that's the factors we talked about. Things like an imbalance between, work effort and reward, being able to have, say, what's called the psychological demands not being met by the kind of impact that having a supportive, validating environment can possess. Looking at the idea of loneliness, feeling like there's nobody that they can actually go and talk to. Then the idea of being bullied and harassed. So these appear to be some of the major work-related factors that seem to make the depression much more salient and associated with work. Now, it's never completely clear to distinguish the two, but we know that these are the sort of top 3 or 4 work factors that really can be triggers for individuals with depression to have what we call workplace factors. That we look at this as saying, okay, we can treat the depression with our usual, but man, if we don't address these workplace issues, people aren't going to get better. Carolyn?
How can an individual address these workplace issues? Are there ways?
It's interesting that when we talk about work-related depression or mental illness, we always think about the worker, and the burden becomes the worker's burden. But in truth, it's a burden that should be shared with the managers and coworkers, because everyone's going to be affected by it in the workplace. So even though it's not necessarily caused by the workplace, if the workplace isn't a healthy workplace, it will make it worse. And we know that the things that put people at risk also are those things that make people who are the high producers at work, like working variable hours. So working too long hours will make it twice as likely as you're going to experience high stress. Or taking on the burden of your company, feeling responsible for your company, makes it twice as likely that you're going to feel high stress. And if you're a middle manager, that will also create extra stress for you, because you're in the middle. You're trying to carry out the policies of the company, and you're trying to support the workers that you're responsible for. So it's not an easy position, and it's a community effort where the community is the workplace to keep a worker healthy.
Absolutely. Thank you so much for that question. Hillary, are there, and yes, Peter.
I just want to say the bells are ringing in my head. And Dr. Chokka is chuckling because he knows where things are coming from. I have a mental health issue. Work exacerbated it. It didn't cause it. There's a clear genetic history in my family. And I had some coping mechanisms, some things that allowed me in a in a low stress environment to survive. What happened was when I got into an environment of work where my work-life balance just was so totally out of whack, and where I was a middle manager and where I was thinking it was on me, that's when things started to go south. And that's when, frankly, that's when I developed some substance abuse issues. Again, trying to cope. So work didn't cause my problems, but they kind of increased the wavelength. It kind of increased the wavelength and made it so that my sort of normal course of coping with issues just was absolutely not going to work. And fortunately, I got to see Dr. Chokka, and he very quickly sorted me out. And forever grateful for that, because I could have been in the soup, that really negative place, for years, and maybe I wouldn't be here.
Well, I'm so glad that you are here to share. And when you say the bells are ringing, when Pratap and Carolyn are listing all the stressors, the workplace stressors, I'm sure that people in the Zoom are also feeling like bells are ringing for them, and they're hearing a lot of things that feel familiar to them. So I'm so glad that you can share your story, Peter, with all of us. Hillary, can we go to the next question?
Absolutely. Our next question is, how can you identify if someone is struggling with mental health or depression at work? What are some of the signs that we can look for?
This sounds like a people manager, and I love this question. Who wants to take it first?
So I think part of what we found in research, because right now I'm doing a study looking at how to train managers to work with employees that are struggling. That when I asked what's the hardest thing, the thing that they say is, when do I say something? Because they see it, because it's usually our very high performing go-to people that are under the most stress. And so everybody wants to, I don't want to insult them, to tell them that there's something off, that I've noticed something. And so they wait. And then the person thinks, oh, nobody notices, so I don't need to ask for help yet. So it's kind of creates this cycle that everybody waits until it's really a problem. And it's almost, when you see it, say something. And it doesn't have to be accusatory. Just, hey, what's up? Can I help? And be supportive.
The things that I tend to hear from my patients and workers is, as this starts off, they begin to feel an overwhelming sense of anxiety and burden of not being able to finish their work. For example, they start to take work home. They're spending more time after hours trying to finish the work they have to do. Now, it varies from individual to individual. Sleep gets disrupted, which is kind of the first things that one needs to pay attention to when things aren't going well. Sleep goes quickly, actually, and it goes from sort of this burnout to stress, and then moving on. And then you're just not sharp, day to day. You're making mistakes. You're having to go over things to make sure you're not missing. And then you got deadlines. Your productivity goes down. People begin to notice that there's a change in your personality, that maybe you're a little bit more irritable, you're more reactive. And so for the managers or the supervisors, I think it's that human thing about knowing your employees, right? And having that human touch and connection, and knowing them when they're well and productive, and seeing a change. And much like with our children or friends or family, right? It's that relationships that are so important in the workplace to begin with, so that when you see changes, you begin to notice. And if you have that connection, and say, hey, listen, come on in. I've noticed some things. Is everything okay? Can we talk about it? And it's that just small little touch points that make a huge difference, I find. So, because I find that a lot of my patients aren't really even fully aware of what's going on until much down the road. And then they go, oh man, I'm not. But when they look back, it's been going on for quite a long time. This just doesn't happen overnight. So I think it's creating that environment of work where there's this ability to talk about things and this wonderful connection between, supervisors and bosses and employees. This is the ideal utopian world that we want, which I think we're fostering or hoping to. And then recognizing that there's changes that are occurring and having a communication to address that much earlier on, because by the time they come to see me, man, that horse is out that barn door, and I'm having to deal with things that could have been much dealt with easier months ago and maybe even years ago. And that's the other thing I want to just say, is because by the time they come to see me, this problem is so long-standing that it's really hard to intervene. And just going back, the data on people when they're off work, Hannah, is crazy, in the sense that if you don't go back to work in the first 6 months, there's like a 50% chance you won't go back within the first year. And after 1 year, it's like 20%, right? So it's that really important period of time early on for both the worker and their environment to recognize what's going on. And I think what we're trying to do with these kind of talks is to bring in awareness so that people can know what's going on at all the levels and get help. Because the sooner they can get help, the interventions are much more effective. If you're on disability for several months to years, it's really hard to get back to the way you used to be. So, early recognition, accurate, diagnosis, integrative approaches, and sort of holistic interventions can really portend a good outcome.
Mm-hmm. And just Peter, to give you a moment to respond to that audience question, I wonder if it has it been enough in your experience that if a colleague or a supervisor says, hey, how's it going? Or hey, what's up? I've noticed, has that been enough? Is there something that you wished people could have said? Or are there examples of times that you remember where people said the exact right thing?
That's a difficult question, because I focus so hard on sort of hiding whatever issue I had. I think I guess I wish that at some point people had recognized that the amount of work I was doing and the amount of time I was spending on it was just completely out of whack. And being new on the job and whatever, you want to please, right? I do see now where, and I know of instances where managers and supervisors have approached people and said, we think there's an issue here. And as long as it's done in a really kind and safe way, it's got to be safe. It can be immensely helpful. If you do it in a kind and safe way, there's no threat, there's no fear, and you get to a point where you're having an honest exchange. And I've had these discussions with coworkers, and if you're having this honest exchange, and it takes a while to build up the rapport, but people will tell you, and often will seek help.
I want to wrap up today's session with one last question about what is the one thing you want to see implemented in every workplace. I'm only giving each of you one thing that you can choose. I know you'd have many, but just before we get to that question, I do want to say to everybody here in the Zoom that even though we have run out of time for the audience questions, if you didn't get your question answered or if you have a comment to share, you can reach out to HRI, the Homewood Research Institute. You just go to hriresearch.com. As well, we are posting a link to a brief survey in the chat where you can offer feedback on today's session, and you'll find the survey launches on Zoom immediately following the event. So yes, to get to that last question for everybody, what is one thing that you do want to see implemented in every workplace? Pratap, I'll start with you.
Okay, all right. I'm going to come in as a psychiatrist. Much like we always used to have physical evaluations for employees, a yearly physical, I really think we need screening for mental health symptoms and disorders done in a routine way. One of the biggest problems with mental health symptoms disorder is that the lag time between experiencing symptoms and diagnosis is so long, Hannah. We've got to change that. And so if we had some kind of, in a safe manner, as Peter said, screening for mental health disorders in the workplace, I would love that, because I think individuals don't know what they're experiencing, employers don't know, but what if we actually had a validated science-based screening that can pick up at-risk individuals much earlier than down the road? That's my big ask. I don't know. It's possible, but that's a wish.
That's a fantastic idea. Carolyn.
I think when we talk about supportive workplaces, that we also understand that to support people, it takes time. So given the middle manager who is supporting the employee, recognizing that will take time, and so taking away some of the other, building that in as an expectation, because that it also is an output for a manager, and recognizing that. So it's not as though, oh, this is another thing I have to do, and I'm not going to meet all of the deadlines and the outputs that I need to make, but recognizing, no, I did, because this worker is still here and is able to remain productive because of that, and I still have cohesion in my group, and recognizing that that is part of the expectations to have a truly supportive workplace.
Mm-hmm. Love it. Peter, is there anything that you would add?
Yeah, and this is a bit obvious and cliche, but I'm a real strong advocate for education and open discussion, and deliberate work to make people, or to allow people to feel safe to discuss this issue, and to sort of dispel some of the fear that surrounds it, the fear of losing one's job, the fear of people thinking less of you, the fear of consequences, that that people understand that their environment is safe.
I think these three suggestions are fantastic, and would suggest if a workplace had them all. So, routine screening in a safe way, time built in to truly support each other, and education in order to destigmatize talking about mental health. I mean, can sign me up. I'd like to work there right now. Thank you all for being here on the panel. To Peter Burgess, Dr. Pratap Chokka, and Dr. Carolyn Dewa, thank you for taking the time to join us and to educate us tonight. And thank you to the HRI staff for their work behind the scenes to deliver this talk. And I'd like to thank the audience for joining us and for your interest in this topic. And now I'll hand it off to Hillary.
Thank you so much, Hannah, for moderating this evening's HRI talk. If we didn't get to your question this evening, please do reach out to us. Our website is hriresearch.com. We'll do our best to respond to your question. And if you haven't already done so, please do subscribe to our HRI Talks mailing list and our quarterly newsletter. And you can follow us on social media so you can learn about our upcoming HRI Talks. Thank you so much to everyone for joining us, including our corporate sponsor, CIBC, and supporting sponsors, KPMG and the Otsuka Lundbeck Alliance. We're so grateful to our sponsors and to all our supporters across Canada and beyond. Thank you so much to everyone for being a part of tonight's event. We'll see you next time. Good night.